Bringing a baby into the world should be magical. But what if it isn't? You expected happiness, but instead you feel anxious, overwhelmed, or even disconnected from your baby. Is it just baby blues or something more serious? Let's break it down. First up, postpartum blues. 1 minute you're laughing, the next you're crying. Sound familiar? You're not alone. Almost every mother experiences this. It starts 2 to 3 days after birth and resolves within 2 weeks. Symptoms include sudden mood swings, tearfulness, anxiety, irritability, and exhaustion. Management? No medication needed. Just rest, self-care, and emotional support. But what if these feelings don't go away? Let's talk about postpartum depression. Imagine feeling completely numb, even toward your baby, or trapped in a fog of sadness that won't lift. Way more common than you think. It can appear 2 to 8 weeks postpartum, but can show up even a year later. Symptoms include persistent sadness, hopelessness, loss of interest, even in your baby, insomnia, extreme fatigue, appetite changes, and suicidal thoughts or thoughts of harming the baby. Treatment involves therapy, antidepressants, and support groups. Ignoring it won't make it go away. But what if your thoughts become dangerous? That's when things get critical. Let's talk about postpartum psychosis, a life-threatening emergency. What if your mind suddenly turned against you? You hear voices, see things that aren't there, or believe your baby is in danger, even when they're safe. Rare, but deadly. It starts within days to weeks postpartum and worsens fast. Symptoms include hallucinations, delusions, extreme confusion, paranoia, and suicidal or homicidal thoughts. This is an emergency. Immediate hospitalization, antipsychotics, and sometimes ECT are needed. This is not something to handle alone. Seek emergency help now. When to seek help? Symptoms last beyond 2 weeks. Possible postpartum depression. Consult a doctor. Struggling to care for your baby. Suicidal thoughts. Seek urgent medical help. Hallucinations, paranoia, or violent thoughts. Postpartum psychosis is a medical emergency. Call for help immediately. If you or someone you know is struggling, reach out. Because no mother should go through this alone. Drop your thoughts below and let's break the stigma around maternal mental health.